what I'd like for you guys to do is just briefly introduce yourselves, and then I'll hit you with a couple of questions, and we can go from there.
All right, I'll go first. I'm Joe Smith, a partner with Thompson Hine, focusing primarily on nicotine and tobacco, and co-head the cannabis practice.
Sarah Marking, I'm the Chief Strategy Officer and co-founder of Sonova. We're a regulatory and scientific consulting group. We help companies bring their products to market.
And Jessica Zadinek, founder and Chief Research Officer of ARAC, Social and Behavioral Sciences Research Firm.
Marina Murphy, Senior Director, Scientific Affairs at Hype Group, which is an online supermarket for non-combustible nicotine products.
Hi, afternoon. Tobias Baude, Director of Corporate Affairs, Next Generation Products at Imperial Brands. For those of you who were here before lunch, and if you do remember, I gave an overview of Imperial Brands' challenger mindset, what we're doing in NGP, so we are a global business offering tobacco and next generation products here in the US and on a global level.
So we're here to talk about harm reduction globally, right? So regulation and harm reduction in key markets. What are the key markets, and does harm reduction mean the same thing in those key markets that it means in the, well, I'll say the United States? So what are the key markets outside of the United States? It's nodding, but no one answered. Do I have to pick on someone?
I think the key markets depend on the product category. If we look globally at some of the trends that we see, obviously heat-not-burn products are very popular in Asia. We see a lot more uptake of those products in those markets. Pouches obviously have a long history in Sweden and the Nordic countries, and we're seeing a real runway still, I think, despite some recent developments for ENDS products in the UK. And so I think what we've seen is that the success of a product has to take into consideration not only the regulatory framework globally, but also the consumer market and what those consumers are going to be willing to accept and what's kind of socially normal in these different areas.
I guess when you say key markets, the question for me is, what do you mean by key? Do you mean a big market, or do you mean an influential market? So if you look at the UK, okay, it's a small country, but it's been very key, I think, in the development of harm reduction regulation. I mean, things are changing slightly, or maybe not. It could be more to do with the narrative than what's actually really happening. But
wait a minute. You can't just throw something out like that and go on to the next thing. Yeah. Things may be happening, but maybe they're not. Can you?
Well, like I said, there's a lot of focus on the UK because it's been seen as a beacon, I'd say, for harm reduction, for evidence-based policy making, for taking a pragmatic approach. And also there's been a lot of attention being paid to the UK now because of the tobacco and vapes bill and because of things like the generational ban. And there are some worrying things in the tobacco and vapes bill, but fundamentally it remains to be seen how much will actually change and whether things will change in reality or whether it's more to do with playing to the media somehow. And is it the narrative or is it the reality? I think it's not clear.
And I would say too, when we talk about harm reduction, what kind of harm are we talking about? So obviously there's the combustible cigarette space and transitioning people who smoke off of cigarettes onto alternative products, but there's also moist smokeless tobacco, right? And so now with oral nicotine category growing across the world, when we look at countries like India, and we look at the prevalence of moist smokeless tobacco users, I know Derek, you and I have had conversations with many others worldwide about this, and the harm reduction opportunity there is taking the highest, by far, prevalence of oral cancer, and other type of risks. And let's use that as an opportunity to reduce the harm, maybe not of the diseases and cancers associated with combustible cigarettes, but with other types of tobacco products.
So you mentioned India, and let's talk about ingredients in different regions and the different taste preference. I know, and you mentioned the incidence of cancer when associated with oral tobacco, but a lot of that tobacco has areca nut, lime, and things like that, which, by the way, I think some of those ingredients are trying to make their way into the United States also. You want to comment on that? And that's more of a cultural and behavioral thing, I think. You disagree? You don't want to comment?
Are you looking at me?
Yeah.
Okay. Yeah, absolutely. And Sarah alluded to it, which is the social, cultural, personal norms are huge, and that all ties into cultural competency that I was referring to earlier. And so while, yes, Willie, some of these aspects are trying to, in rituals, habits, very cultural based, are trying to get themselves potentially into the U.S. market, and vice versa, right? Like we sometimes, we see clients trying to get, as I mentioned earlier, into another country, but that's not relevant to the social and the personal norms there, and ultimately that product will typically fail. So I think people can try, but until it is the right place, right time, and there's an adaptation to a cultural environment, it won't succeed. And so we look at this really translatory, I hope that's a word, within the United States and the pouch market, right? So it is a new market. The United States oral nicotine pouch market is new when you look at other parts of the world. And so right now, being able to, or wanting to bring, a wet white pouch that is 24 milligrams nicotine, right now, consumers aren't ready for that. But hopefully you're looking future oriented and down the road, and let's give it several years and look at other countries' trajectories of going from a drier pouch, lower nicotine level. The consumers adapt, and then they'd be ready.
So as we think about these key markets, which we have somewhat defined, thank you, Sarah, do they have similar concerns like youth use and illicit products? And you can pick a market and talk about it and expand on it. Any one of you guys.
Well, I think it's the same arguments are used, I think, across the board. People love to talk about youth epidemics, whether they exist or not. Flavors attracting youth, brain damage. It's the same arguments used over and over again. And when you look at the nicotine pouch market, like you said, nicotine pouches are as close to medicinal NRTs almost as you can get, right? And a lot of them, they're very simple products. They're very similar to NRTs in the format, and for the most part, they're not like the vape products in that the sector hasn't gone down the road there. There's not, generally speaking, there's not pictures of Pokemons on boxes of pouches. Yet you still hear the same argumentation made when governments want to go down the route of imposing strict regulations on pouches, using exactly the same argumentation and paying no attention whatsoever whether there's any factual basis to it at all.
If I can just add to that, in some of these key markets, we're actually seeing more of an argument towards their concerns in environmental aspects and sustainability of products, specifically right now UK disposable ban and other countries talking about it, versus youth use, right, and the youth risk. And so while in the US, I do fundamentally believe that was the key take-home message driving a lot of why we are in the situation we are when it comes to flavored ends products and what it takes to get through the pathway. But in other countries, there are other variables that are impacting the difficulty in getting to market or removing them from the market.
Do you guys see these regulations and in these key markets influencing the U.S. in any way? And then, Joe, for you, what about bringing these products into the market given the current administration and things that are going on? I'm just throwing questions out. You guys
It's
decide.
5:30, nap time. Can you repeat the question, please, Lily?
Okay. The question. You know what? I'll be very specific. Let me just go to. Let me look. Yeah. Sure. Since nobody wants to see the answer to the question. Jessica needs it now. No. In terms of what the U.S. is doing now, and so harm reduction, you have to have access to these products, and so a lot of products are manufactured in other places. We're having a difficult time bringing products into the U.S. What's impacted that?
Yeah. So obviously, the biggest thing that has been talked about today and is always talked about at these conferences is issues with the TCA, the PMTA process, and the ability to bring these products to market. I mean, this is a very innovative industry. These products develop quickly, and the opportunity for harm reduction is there and is seen in other countries, but unfortunately, the way our system has been set up, and especially the way it operates, it's not allowing for those products to get to market. If people are wanting to do it 100% right and get the PMTA, go through the PMTA process before they bring it to market, it'll be years before they actually get to market. Whereas, and they look out and they see other companies just putting their products out there. They can get it imported, they can find someone to sell it. Other companies are doing that. And folks that are wanting to do it the right way and get the PMTA, get the MGO, they know they're back in line, and frankly, by the time they could get that MGO, the industry could be 5 steps ahead in terms of what products are appealing to consumers, what the developments are, what other countries have. And so, basically we start from a prohibitionist perspective and attitude rather than a harm reduction attitude, and that doesn't even get into all the issues raised by how the states operate as well.
We've seen two big approaches. The U.S., you don't put a product on the market until we say. I guess it's the EU, UK. Yeah, generate some data, have it in case we ask for it, and I'm summarizing crazily, I know. But go ahead and provide these products to consumers. But yet, don't we see the same issues, illicit, youth? I mean, is one approach better than the other?
Okay, a 545 attempt to a very straightforward question, but I think the answer is going to be quite complex. So trying to keep it simple, I don't think one approach is better than the other. They both have pros and cons, right? As in Europe, where we have, in most cases, standards, regulation based on standards, and negative lists that prohibit certain ingredients, we don't necessarily have certain issues that we've come across here in the US. So, it kind of goes to show that these models are promising and they do work. Now, if I can bring us a bit more to a more regional, global view on this, whatever you do as a regulator, you have to think about what matters here from a public health perspective. You can't ignore the consumer. Consumers aren't patients, you can't prescribe a solution for them. You have to recognize that they have needs, preferences, they want to take choices. So you have to give to them safe products that are marketed responsible, but they need to be available. They need to be available within certain limits, yes, of course, but they need to be available. You can't come from a prohibitionist approach, because when you do that, all you're doing is you're fueling the illicit market, you're giving space, freedom to operate, to the illicit and multiplying players, and no one would benefit from that, and certainly not the consumer.
And if I can jump in here to respond to something Joe said right at the end, which was the circumstance we find ourselves in here in the U.S. and the lack of support for harm reduction framework and the products in the market. I think that fundamentally, though, comes from the fact that we have a federal government and regulatory body who, I don't know if they believe in harm reduction, right? And so we do, sitting in this room, we do who have been in the industry for years and can actually see what reduced risk products do to cessation, switching, and the population level and individual health benefit to take cigarette smokers away. But we first have to get the federal government, who's regulating our industry, to agree that there is a harm reduction framework worthwhile, and then maybe products will follow.
I think there's a fantastic point to build on here as well, and as we can highlight some of what I think these global markets are doing very well. If you look at the UK and what the UK has been able to do with vapor, if a smoker is in a hospital for a different condition, they actually get a consult while they're there. Someone brings them a vape kit and they say, here's how you use it. They get coaching. And a lot of those consumers will ask the same questions that people in the US ask their doctors. Is this vape just as bad for me as smoking? And they get an honest answer from that consult that says, no, actually, the data shows that this product has lower levels of harmful and potentially harmful constituents. It could potentially translate to a health benefit for you. In the US, someone goes to their doctor, the vast majority of the doctors in this country incorrectly answer that nicotine causes cancer. Why would they recommend that their patients switch to a nicotine-containing product? We have a serious issue with misinformation in this country, to your point, and I think that factors into not only the advice that clinicians give their patients, but it factors into the public perception, and that trickles down into the politics and the regulatory framework that we're all trying to exist in.
Yeah, and to build on that point, I mean, we're already seeing it in the litigation over ENDS products, but also, the city of Baltimore just last month filed a lawsuit against PMI and Swedish Match over Zyn. Despite it having an MGO, they filed suit, and it has colors, it's got flavors, they use social media, they have a rewards program, they're awful, and the focus now is no longer about tobacco or causing cancer or carcinogens, it's nicotine. They've moved the goalposts, and it's led to this idea, as was just mentioned, that vaping, these alternatives, are just as bad, if not worse, than cigarettes, which just isn't true at all.
And that is a fantastic triggers an idea in my mind to bring in another example of a market where maybe there are some issues on harm reduction. Do we have any colleagues here from Australia? I didn't think so, but it's another market where EVP is just available in the pharma model. Very recently, no longer prescriptions are required. There were only a couple of hundred doctors in Australia who had the license to give prescriptions. We're talking about a huge, massive country, so that clearly wasn't a well-designed approach. But the issue that there are in Australia are that there is very limited uptake of consumers going through the over-the-counter model in the pharmacy. But what you will find is that the non-compliant illicit trade is very high. And if that is the case in a very controlled market, Australia is a huge autark area. It doesn't bode well for other countries if we look, for example, at very interconnected countries in the middle of continents elsewhere. So Australia has a very negative view on nicotine, and you can see the model of regulating it away in the pharma model clearly also doesn't help for consumers to switch away.
So I'd love for one of you guys to talk about the Swedish experience, right? I mean, the smoking rate's extremely low. That's data. There's hardcore data, and there's hardcore data on how that happened. Why are markets around the world just ignoring that?
Yeah, I think the Swedish experience is probably the most well-known example where you have availability and uptake of modern oral alternatives that have been widely accepted in society. You have high rates of women smokers, former smokers in that country also using these pouch products, and it has a lot to do with what's socially acceptable in that environment. And as Whitley pointed out, they are at their tobacco endgame. They have the lowest percentage of smokers, I think below 5% now in their general population. And I think what the Swedish experience tells us, and what we've seen in the UK with vapor, is that providing consumers with a variety of alternatives that will help them switch works. And I think what we're seeing in other markets, we haven't mentioned France with the potential ban on nicotine pouches there as well, in addition to what's happening in Australia. I think what we see is prohibition doesn't work. And prohibition in and of itself leads to this very prominent, vibrant, illicit market where we don't have control over the products that consumers are using.
Yeah, France is a great keyword. You would think it's common sense to simply adopt the THR model, and of course you have, regional, national tweaks. Of course, every country is different, but often policies are driven by emotions. They are misled by pseudo science or not science at all, to be honest. Yeah. You mentioned France. France has now announced last weekend that they would like to propose new laws to regulate away flavors for vaping. It's just another example of how media stories, and I'm not dismissing them, yeah, just for the record, but they are taken out of a proportion and suggest that there is a huge issue with product categories as a whole. And I think we as an industry here and other stakeholders here do have an important role to play, because there is something we can offer to illustrate these positive cases, because the data and the facts, they speak for themselves, and we just need to cut through all the noise and make sure they're heard.
But Willie, you asked why doesn't that translate? That data is data. I would disagree a little bit there, because each individual in this entire world is different from each other. Put them all together in a city, and then a state, and then a region, and then a country. We see over and over again differences from state to state, from region to region. Why do we think the FDA wants and has asked those conducting Module 6 research to make sure you cover the 4 U.S. geographic regions? Because there are differences. And so when we look at the Swedish experience, yes, it's data. I would encourage folks to look at all the variables I mentioned earlier that contribute to behavior, specifically nicotine, tobacco, product use behavior, and find segments within the United States that match that as closely as possible. And then I do think it could translate. But it makes sense to me why FDA says we want data from the United States consumer, right? And we will certainly accept secondarily supportive evidence from other countries. But again, each individual is so different, and so we have to first explore in the United States what's going to work for this consumer base, but use the segmentation within the United States and find that key group that matches the Swedish experience.
But, okay, you're talking about people here, but I'm talking about key factors. You give people a product that's less harmful and you encourage them to use it, and the government encourages them to use it. That seems like simple, it's the concept. Right? The other thing is, in the United States, I know Azim talked about opening the Tobacco Control Act. I think that would be disastrous, and I talked with him about that, and he didn't necessarily disagree. But it seems like, for example, in Europe, there's a review every so often of the TPD, I guess, right? And so do you see that moving in the direction? Are they leveraging this information to make the regulation better? I'm not talking about the World Health Organization, but you can comment on that as well. And I know Derek can as well.
Europe, or the EU, I think, has always struggled with, what its strategy is regarding harm reduction. And it doesn't help that there's such, I'd say, chaos and confusion as regards how the different member states view the different products. And if you talk about nicotine pouches, for example, you said that France wants to just outright ban them. Spain wants to de facto ban them by having a nicotine level that's so low, they might as well be banned. Other countries want to ban flavors. And then you have Sweden that is supporting nicotine pouches. They have issued a detailed opinion, so that will hold up what France wants to do for about 6 months. But actually, in the snus case, the government didn't support snus, actually. That happened, it had nothing to do with regulation. That happened all on its own. And traditionally, the Swedish government haven't actually been great when it comes to revising the TPD. And the TPD is due to be I think they're talking about this year. There might be there'd be the draft proposal. And then, of course, that's intertwined or linked to what happens with the COP, because this is a COP year, so you have the FCTC. And, you know, which comes first? Will it be the TPD feeding into the COP? Will it be the COP feeding into the TPD? And I think when you look at the disparity, you know, among the member states, I think it doesn't bode well for what position the Euro, you know, FCTC group is going to bring to the FCTC. Are they going to have a less than positive position on harm reduction and harm reduction products?
I saw you looking at me, so I could add some more color to EU TPD if that's interesting. At 5:50, looking at our esteemed audience, I see some smiling faces looking up from the stage view. So yeah, look at European Union. Lots of things could be said. I'll save them for later at the bar. The Tobacco Products Directive edition number 2 is currently being reviewed by the European Commission. They haven't concluded their review yet. We're expecting them to say more about that in the course of 2025. Whether there will be a draft of TPD3 this year or next year, really good question. We wouldn't be surprised if it's 26. So we could imagine TPD3 coming into force at when maybe 28, 29. So a long way to go, but what we do see...
Do you see a positive are they moving in the right direction, 1, 2, and 3?
Let's talk about this next year when hopefully we have seen. Okay. We don't know yet, officially at least, what they're thinking of doing. And look, similar themes are valid there. You know, we are hoping that they would base their views on the facts and the science, and that they would, for example, take a very measured approach when it comes to flavors, for example, for EVP or for modern oral nicotine. Early discussions in Brussels don't necessarily suggest that they will. And what you also find in the European Union at the moment with its 27 countries is that we see a growing impatience. Countries have to deal with, you know, the real marketplace out there at the moment, and they don't necessarily can or want to wait in their perspective until 28, 29. And so I think some of you guys touched on that in your respective talks earlier, see somewhat of a fragmentation as people take initiative and add additional ingredients to ingredients lists, or look at other measures, for example, regulating certain product categories, disposables, etc. So I wish I could say the European model is, you know, the best in class. There are definitely some positives in it, for sure, but it doesn't come without its own challenges. And look, we are promoting, as Imperial Brands and others in this room here are doing the same thing, to partner with stakeholders and regulators. We can't do that job. They have to regulate. But to educate them and make available to them science and the consumer data that we have, so that they can take informed decisions as they write TPD3.
I think it's very worrying to see countries like France take the view that the nicotine sector is the tobacco industry, and then start to treat every nicotine product like it's a tobacco product, or worse than a tobacco product, because let's face it, France is not going to ban cigarettes anytime soon. Not that they should, I don't believe in bans, but the fact that they're willing to ban nicotine pouches, which, like I said, are as close to a medicinal NRT as you can probably get. I can't imagine, I'm trying to imagine, how can you make it more like a medicinal product? I mean, medicinal products are flavored as well. So I think that's really worrying. And it's not helped by the WHO who are pushing this agenda. They have a prohibitionist agenda. They're basically trying to use science to redefine the definition of combustion, redefine what constitutes smoke. So, I mean, I think one of the definitions I saw would make the steam from a kettle, that would be smoke. And then redefine what it means to quit. So quitting smoking is not quitting smoking anymore if you have decided to move to a nicotine pouch. So, you know, I think that's very worrying.
I hear you guys talking about the importance of politics and key markets. That's a theme that I'm hearing from each of you, and its influence. and science and evidence takes a backseat to politics. Did I summarize that correctly? Is there any market where that's not the case? Jessica's thinking.
I would say it's either the chicken or the egg, right? So I think we in the United States got to partially where we are is because political individuals and groups funded the science and the research that then cyclically came back around to support the political objective. And so I think both of them can kind of, support each other's objectives how they see fit, which is a shame. But that's always been the case, though. Even in the federal government, I saw politics impact program development, to reduce HIV and AIDS epidemic, that I was working on. And so it's everywhere. And I've seen it for 25 years. And so I don't think it's unique to our industry. It's a shame, right? But that's why you have, people on stage like us and yourself who seek truth, seek, real science, and want that to guide action instead of politics.
If you're thinking about the notification versus authorization, the authorization process is what makes the US so different to everywhere else. I think it's very hard to have an authorization regime that's not politicized, because the regulator has to say yay or nay, and you're damned if you do and you're damned if you don't. So,
well, if nobody's happy, I heard they're doing their job well. Any questions from the audience? We got probably time for a question or two. I know, it's 5-something. I know. And we got a little ways to go, but you guys are troopers. Hang in there. All right, I want to thank our panelists. Thank you guys for sharing.
Thank you, Willie.
Really appreciate it.
Thanks very much.